Good afternoon, everyone. COVID-19 has highlighted societal inequities and exacerbated pre-existing disparities in racial health outcomes. For example, in Chicago, Black people accounted for 68% of deaths due to COVID-19. Significant efforts have been invested in closing that gap, and there have been improvements. However, disparities remain. Black people now account for 39% of deaths, while white people account for 22%. The reasons for this are complex. Here in Chicago, we can look at racist policies like redlining, which have led to historic disinvestment, food deserts, and environmental injustice, which are all contributing factors to pervasive pre-existing medical conditions and lack of access to quality care in communities of color. While addressing health disparities will take a multifaceted approach, one place we can start is close to home. I propose that the Department of Health and Human Services require hospitals to establish a community advisory board to serve as a bridge between people of color served by the hospital and the hospital staff. Why do we need community advisory boards? Historic mistreatment from the government and from healthcare providers remain in the collective memories of Black Americans and have led to mistrust at a time when we need people to trust them. For example, the Tuskegee syphilis experiment, where Black men believed they were receiving treatment from the government for syphilis, when instead, without their knowledge, the US government gave them placebo pills and then tracked the devastating impact of the virus on their bodies. Provider bias remains a concern. Biases and honestly systemic racism lead to assumptions about Black people, and this has an impact on the quality of care that they receive. As an example, in 2016, 40% of medical residents surveyed believed that Black people were more impervious to pain than white people. Now, this is important because Black patients are less likely than white patients to receive pain medication when complaining of the same or similar issues. We need to get to the root of this mistrust. Community advisory boards can advise hospitals on training, on perceived problems or lack of care for certain communities, and on areas in need of improvement, while also serving as a bridge and a source of communication between the hospital and the community. Who will serve on community advisory boards and how will they operate? Well, they will be comprised of people who know the needs of their community. Elected officials, community leaders, faith-based leaders will all apply to join. The hospital can then establish a transparent selection process that ensures true community representation. They will meet regularly or at least quarterly with hospital administrators to express community concerns, ask what has been done to address previous issues, and look for ways to help the hospital share out information with the community. Once a year, the committee and the hospital will report to the Department of Health and Human Services on results of the meetings, progress that has occurred, and areas for improvement. Funding will be tied to how they address the concerns raised by the task force. This already works. Federally qualified health centers are community-based health centers that serve approximately 24 million people. They serve majority people of color, and their funding from the government is tied to providing quality care on a sliding scale, and most importantly, they're governed by 51% of residents of the communities they serve. So what happens in these communities served by community health centers? Well, the services are tailored to the needs of the communities they serve, and in these communities, health disparities are reduced. In fact, according to the Centers for Disease Control and Prevention, community-level solutions work to reduce health disparities caused by differences in race and ethnicity. There is still a need for hospitals and traditional healthcare facilities. However, if they choose to receive government funding, they must be held accountable to be receptive to the needs of the community. And so community advisory boards can raise concerns, hold hospitals accountable for addressing those concerns, and assist in communicating important information. And finally, why should we care? Well, aside from the obvious ethical and moral reasons, this is costly. The total cost of racial health disparities in 2009 was approximately $82 billion. That's $60 billion in excess healthcare costs and $22 billion in lost productivity. That is increased. In 2020, it went up to $135 billion. And there's a potential economic gain of $135 billion per year if we address disparities in racial health outcomes. So erasing racial health disparities and improving health outcomes for our communities of color is the morally right and economically advantageous thing to do. It will require a variety of approaches, but one place we can start is close to home with community advisory boards. Thank you.